The Ministers of Health of Aruba, Curaçao, and Sint Maarten, together with the State Secretary of the Ministry of Health, Welfare and Sports of the Netherlands, convened on Thursday, 20th November 2025, in Sint Maarten for the four-country consultation on public health. This annual high-level dialogue remains a cornerstone for coordinated health governance and joint policy development within the Kingdom of the Netherlands.
Thank you, State Secretary, thank you, Ministers, and also thank you, all delegates. This marks a milestone in our collaboration for the past 4 days. I will now call on the State Secretary and the Ministers separately to highlight national priorities and next steps.
Dear Distinguished Governor, Distinguished Minister Broek, Minister Wijndras, and Minister Middelhoff, dear all, what an honor and pleasure it is to be here and to meet all of you today for this annual four-country meeting. And Minister Broek and dear Governor, thank you for hosting this meeting in beautiful Sint Maarten. Each time this gathering takes place, it reminds us of our unique bond and our shared commitment to the Kingdom, to protecting and promoting the health and well-being of our people. First, let me express sincere gratitude to each of you, colleague ministers, commissioners, and also the dedicated teams of civil servants. Your ongoing dedication and hard work is of crucial importance for the well-being of the people in the Caribbean parts of the Kingdom. So I would almost say, applausje voor jezelf. Over the past years, we have continued to deepen our cooperation in the vital area of public health. We are here to welcome the development and achievement of the Dutch Caribbean Public Health Network, in other words, DUCAFEN. So far, the network not only serves as a way to strengthen local capacity and expertise in infectious disease control and pandemic preparedness, it also helps develop an infrastructure for the exchange of information, of regional surveillance. The COVID pandemic, which is still in our heads, had taught us the importance of strong cooperation, and the Netherlands is pleased that the DUCAFEN network has been established. It creates a unique platform for public health cooperation in our kingdom. We are also here today to show that we are able to strengthen mental health services by joining forces. With our joint efforts, we aim, where possible, to create alignment between our laws and regulations in the field of involuntary and complex mental health care. Patients who need this particular kind of health care are among the most vulnerable. And I'm truly grateful for the willingness of each of our countries to work together and help providing these services to patients from islands where such care is not yet available. And we take important steps to improve crisis preparedness, which is essential for ensuring that the Kingdom can respond in a coordinated and effective manner to any health crisis. These are some examples across the Kingdom of what we can achieve when we act as one. As we look ahead, we cannot ignore the complex global challenges we face. Pandemics, the burden of non-communicable diseases, shortage of medical staff, and crises such as hurricane season. Personally, I advocate during my travel in the Caribbean parts of our kingdom for more awareness on gender equality in healthcare. When we invest more in women's health, we invest in our whole society. And I'm looking forward to share knowledge among ourselves to improve women's health. Finally, all these challenges remind us that cooperation is not a luxury. It is a necessity, not only through technical cooperation, but also through building trust. Trust that 1 + 1 + 1 + 1 is much more than 4. It sums up to our kingdom. In these times, the bonds within our kingdom between Aruba, Curaçao, Sint Maarten, Bonaire, Saba, Statia, and the Netherlands are more important than ever. By continuing to work together, we strengthen not only our health systems, but also the resilience and unity of our kingdom as a whole. And I'm happy that I'm part of that.
It's a privilege to stand here today in St. Martin for the four-country consultation on public health. This platform constitutes to be an essential forum for strengthening coordination, solidarity, and shared responsibility across Aruba, Curaçao, St. Martin, and the Netherlands. We have gathered four countries with one purpose. We remind ourselves that public health is not defined by borders, but by our collective commitment to protect and uplift our people. The last consultation was held in 2023. Since then, our public health landscape has continued to evolve. With rising chronic diseases, mental health pressures, an aging population, and the ever-present need for crisis preparedness, none of these challenges can be faced in isolation. Today, we demonstrated once again that collaboration is not just beneficial for our region, it's indispensable. Our discussions focused on areas that will shape the future of our health preparedness, improving crisis and disaster response capacity, advancing mental health initiatives, and healthy lifestyle promotion, and bolstering continuity of care, workforce development, and training across the kingdom. A central theme was the continued growth of DUCAPN, the Dutch Caribbean Public Health Expertise Network. This network is becoming a cornerstone of cooperation, enabling our islands to share data, knowledge, and expertise more efficiently than ever before. I want to extend my sincere appreciation to Mr. Brook for hosting us here in St. Martin with dedication, warmth, and professionalism. Before moving forward, allow me to take a moment of joy and Caribbean pride. My heartfelt congratulations to the Curaçao national football team, our proud Blue Wave, on their extraordinary qualification for the World Cup. This remarkable achievement is a testament to discipline, perseverance, and the unbreakable spirit of the Caribbean people. Today, Curaçao stands tall, united in pride and purpose. Your victory lifts not only your nation, but the entire region, reminding us of the power of teamwork, dedication, and hope. Pa bien, Curaçao, nos está sinti orgulhoso junto com você. I also wish to extend a heartfelt word of thanks to the many civil servants, technical teams, and policy professionals across all our countries. Your work, the long days, the countless preparations, the drafting, aligning, and refining is that make today possible. You are the backbone of the process. And on behalf of Aruba, I express deep gratitude to your dedication, professionalism, and endurance. Finally, I would like to acknowledge an important moment for Aruba. We are honored to assume the chairmanship of the four-country consultation for the coming year. It's challenging, but it's a responsibility we welcome with commitment and pride. We look forward to hosting the next session and continue to work that we have collectively advanced today. Aruba will strive to continue fostering cooperation, innovation, and unity within the kingdom, always guided by the conviction and that a healthier kingdom is indeed a stronger kingdom. With agreements signed today and the spirit of collaboration and strengthened, we move forward with renewed determination to build a resilient, inclusive, and people-centered public health system for all our islands. Thank you. Dankie, bedankt.
It is an honor we carry with our heart. Your confidence in us shows the trust that defines our cooperation, and we are committed to serving with dedication and respect. I want to reaffirm a conviction that guides our vision to the future. A strong health care system is built on preparedness, prevention, mental well-being, quality, and a capable workforce. By committing to these principles together, we strengthen our collective resilience. Mental well-being is not merely a health topic. It is the center of strong societies, of productive workforces, and of families who feel supported and safe. Thank you for allowing Curaçao to lead this crucial part of our collaboration. Today, I also want to underline the importance of the onderlinge regeling. This agreement is not just a technical instrument, it is the backbone of our cooperation. It ensures that our commitments are clear, our responsibilities shared, and our ambitions aligned. The onderlinge regeling is more than paperwork. It is a promise of transparency, partnership, and a long-term collaboration. A promise that we move forward together. That's why I want you to be patient, because I would like to dedicate enough time to review and bring the best version on table for us all. To every country represented here, Aruba, St. Martin, and the Bass Islands, I want to say this clear. We have heard your requests, your concerns, and your priorities. And as one united family, we will make it happen one way or the other. Because families step on for one another, families stand together in challenges, and families find solutions even when the path is difficult. What you have asked of us will not be forgotten. It will be acted upon. Preparedness, prevention, mental well-being, and a capable workforce guide us. But unity is what empowers us. Unity is what transforms agreements into actions and cooperations into progress. Let us leave this meeting with renewed conviction. Let us continue to uplift one another, support one another, and strengthen one another. Because when Curaçao advances, so does Aruba, so does St. Martin, so does the Bass. And when St. Martin becomes stronger, the Bass, Curaçao, and also Aruba Islands and the Netherlands benefits too. Our destinies are interwoven, our resilience collective. Just as my colleague says, we stand united behind the blue wave, the pride of Curaçao. As they make their historic journey to the FIFA World Cup, so too do we stand united here today. Their strength is our strength, their victory is our victory, and just as we cheer them, one side by side, we too move forward as one team, one kingdom, one family, united in spirit, united in purpose, and united in destiny. Thank you.
I agree that this process that we have just completed is one that is very important, that will make a definite difference for the people of St. Martin, Saba, Statia, Aruba, and Curaçao. All of us together. Have I forgotten an island? Bonaire. Oh, good. Okay, then. And Bonaire as well. Because at the end of the day, our focus, all of us, is the public health, the people of our nations, our respective nations, especially the vulnerable group. I've said it on several occasions. We have the same common goal, the same common motivation, and that is for the people that we are serving, the people that we are here to represent. As brothers and sisters, we may fight at times. That is true. But at the end of the day, we always find a way to come back together, hug, kiss, and we even forgot what we fought about. That's how family works. And we are a family. We don't always see eye to eye. But on this aspect of public health, on what we're doing, we're seeing eye to eye, and we're going to move forward together for the people that we represent. I come from a notion, those that know my background, VKS, and it is, we leave no man behind. We will leave no Dutch kingdom behind. All of us will move forward. We are each other's brothers and sisters keeper. And just like you said as well, when one progress, all progress. Can I hear that? When one progress, all progress. When one progress, all progress. Amen. To the civil servants, the technocrats that were behind all of this. Because as ministers, we had the easy part, to be honest. Because yesterday I sat at the back and I listened to how the negotiation went. Wow, that's a skill. That's a skill. I don't even think we pay you all enough. But nevertheless, thank you very much. Thank you very much for all that you have contributed to making this possible. And for the people, please, please don't give up on us. We have your best interests at heart, and within the next coming years, you will see the fruits of our labor. That we can guarantee you, together, right? Thank you very much, and enjoy the rest of the event.